Everybody hear me? Okay, so I'm super excited to talk to you all today. I've done this before, but it's been to middle schoolers. They had a lot of different questions, but after we talk, you can feel free to ask me anything. I always love sharing my experiences because, especially in the healthcare field, there's so many more opportunities than you probably think that's out there. So I'm just going to start. I'm a North Greene High School graduate of 2005. I graduated there. I was a valedictorian, and there was a couple of us actually, but I went on to ETSU. But one thing I want to say is scholarships. My mom and my guidance counselor, we pushed each other so much, and all these little $1,000 scholarships here and there. I did an essay for all of them, and it actually went in my favor, and I got out of college with no debt. So just a little plug there. Any scholarship that you can think that's out there, just do it. You never know if you're the only one that applies and you'll get it. So I started at ETSU. That was my mom's college, and at first I really didn't know what I wanted to do. My mom is an electrical engineer. She's nowhere near a nurse, but I actually had a neighbor that was a nurse, and she really mentored me and saying, hey, you need to go into healthcare, you need to go into healthcare. It's a good, stable job. And I thought, well, okay. So after my first year, I applied, 2 years. I applied for the College of Nursing, and I got in. Nursing school is a little tough. College in general is, when it comes to writing papers, that's where I struggle the most. So if you can write a paper, you can get through college easy. And then once I got into nursing school, we did a lot of speaking, or actually more presentation. And I'm glad I did that because I was sort of an introvert and I didn't speak a lot. So it really got me out of my shell, especially, and prepared me for what was coming next. So while I was in college, I had an internship. It's called a Nurse Intern 1, and you can apply for that it's like the summer before your senior year. And I know that Laughlin has it, and now I think Ballard all the way around has it. And you work one-on-one with the nurse for 6 weeks, and you really get to do everything he or she does for that whole 6 weeks. That was probably the best experience that I had, and I got to do it in an emergency room, which was crazy. And I'll tell you a little bit more about that in a minute. But then after that, they hired me on as a nurse intern 2. So I got to work. It was sort of like CNA job stuff, but I'm really glad I did it. And I got to do that my whole senior year. So I would work every Friday and Saturday night shift for some extra cash while I was in college. So then I graduated, and because of the relationships that I made during my internship and at Laughlin, I guess now it's Greenville Community East, they hired me on there in the emergency room. So that was exciting and terrifying at the same time, because the emergency room, you never know what you're going to get when people come in. And at Laughlin, we didn't get the big stuff, but the people that were not flown or taken by ambulance that walked through our doors, we got those. So I have so many crazy memories from the ER. That's really exciting if you like guts and gore. But and another thing too, you really think that I don't think I would ever like that, but you never know till you try it. That's why it's good to have internships, or if you can job shadow someone to really get a feel if you would like it or not. So then once I graduated and I got the job, I worked there for 5 years in the ED. But what was crazy is about 2 years in, they had a consultant come in for their computer system, and they wanted a nurse to help them build it. So I was the new young nurse straight out of college that actually knew technology. And you all are in a good spot too, because you all had way more technology than I did. I didn't have texting till I was 18. Anyway, um, so they're like, Haley, you're new, you're techie, you go. So I spent 6 months with this consultant building their emergency department EMR, which is their electronic medical record. And this all was just going. So we were still half paper and still on the computer. So I helped them do that. And that experience led them to trying to offer me a job in IT. Well, at that time, I'd only done 2 years in an emergency room. And I was like, I just don't feel like I've done enough time. Like if somebody passes out in front of me or I come up on a wreck, I want to know what to do. That's the whole reason I decided to be a nurse. So I still worked with IT on a lot of projects. And then about that 5 years in, they really wanted a clinical person in IT. So then my boss took me in her office, shut the door. I thought I was fired. I was like, what is going on? She said, Haley, they have decided to try to open that position back up in IT and you need to do it. Like, I'm going to make you do it. And I was like, oh gosh, are you sure? She's like, I'm afraid I'm going to miss it, you know, ER and all that stuff. And she said, Haley, it's an opportunity that you've got to try. So I decided I'd go for it. So I started that. I was actually 9 months pregnant when they hired me. So I went on maternity leave. And when I came back, I started in IT. And that was really a hard transition because I didn't know all of the IT talk, the lingo, and all that. And I felt like all these people were way more smarter than me in IT. But then as I started doing projects and stuff, we actually leaned on each other a lot. So then I started building in the computer system. I trained doctors and nurses, and I did all the education for them. So if we had something new that came out, if Medicare wanted us to do something new, we had to actually try to get buy-in from the doctors, buy-in from the nurses to actually do it. And then if the saying goes, if you didn't document it, you didn't do it. So we had to really push forward all this. And this is the same exact time that doctors were having to go from paper to the computer. And sometimes they were not the easiest to work with. But we had a couple really good doctors there in Greenville that helped us. So my journey doesn't stop there. So I was loving IT, been in there probably 5 years. So I'd been a nurse 5 years, IT 5 years, and then the merger happened. So I was like, oh, you know, what are we going to do? Because I know that the two different big hospital systems had two different systems, and they didn't have what little Greenville had. So we were in limbo for a while. So then they decided to, like I said, merge. And they gave us an ultimatum. Either we could go into education or we could go into building in Epic. So I chose the building part because I don't know why I did. I just decided to. So then it was like one day they said, you're going to Johnson City to work from Greenville. And that was a little bit different because that was a commute for me. And then the next thing I know, about 2 weeks later, they said, you're going to Wisconsin. You're getting on a plane and you're going to Wisconsin and you're going to learn Epic. So that was exciting and terrifying at once. So I was sent to Wisconsin, had to come back, take a test. Then I had to go back to Wisconsin, take another test. And finally, I got certified in Epic to actually do anything in their computer system. And it was really scary because if you didn't pass the test, I don't know if I would have had a job. So that's another thing when it comes to being prepared in college and learning, you know, I said writing papers and speaking. Well, test taking is big because when you get out, you have to stay certified and you got to keep your education up to date. So I've been with the Epic team for 2 years now. And I just started as an analyst and now I have 11 people under me. And I'm the youngest one. That's a little hard, but, and the reason I think I got that position is because I was a nurse. So again, we have RT, respiratory therapists on our team. We have pharmacy techs on our team. We have IT people on our team. It just takes good collaboration for all that. And on October 1st, we're going to take 12 hospitals live onto this computer system. So October is going to be crazy. So that's just a little story about where I'm at, but I was going to go ahead and talk about some of these points here about like a day in the life. So my typical day, I'm going to do a little bit of the nurse first because I know probably a lot of people like the ED side a little bit more. So a day in the life in the ED. So when I first graduated, I worked a 3 to 3 shift, 3 p.m. to 3 a.m. I really liked it. I wasn't married. I didn't have kids. So, and I would work every shift if somebody called in. I just loved it that much. And then I went to a 10 to 10 shift. And then I went to 11-11 shift. Then I went to night shift. And then then that's when I had kids. And it was really hard working night shift. The money was good because you get paid more when you work night shift. And you get paid more when you work in critical care, FYI with that too. So that's your emergency room and your ICU areas. So it was taking a turn on me. And that was probably one of the things why I changed and went to the IT position, because it was Monday through Friday, 8 to 5, off weekends. My husband worked 8 to 5. So not only did I make a career decision, but I made a family decision too. And I know that's hard for y'all to think about that right now when you don't have, kids and stuff, but that's something to look at too moving forward when you choose your career path. So the day in the life of the ED, again, you never knew what you was going to get. You had good days, you had bad days. I had crazy days with crazy stories and police bringing people in, and I've been spit on, scratched, all that stuff. But there's only so many years of that you can take. I have friends that still work in there for 20 some years. So it's just whatever you want to do. But I'm so glad I had that experience, because I still believe I keep all of my CPR up to date, my PALS and ACLS, that's your advanced cardiac life support. I always keep that up to date just in case I need my nursing background again. And I keep my RN up to, which you have to pay every 2 years to the state to keep your license up. And you have to take so many education classes. But I try to keep all that up to date. But there's not really a day in the life of the ED, because it was always crazy and different. But the work environment there was sometimes very hectic. Because you would either have, the family was very upset, or you had a parent that was upset if a kid, one time we had a kid jumping on a trampoline and dislocated and broke their ankle, and it was just ugly to look at. So the dad kept passing out, and the mom was hysterically crying. So you had one nurse taking care of the calm kid, and then nurses trying to take care of the parents. So, and it's just, how the ER, if you've been in there with family or been in there yourself, it's a sort of intense, high-paced job, but it's an adrenaline rush. My favorites were when we would have people that came in and had a heart attack. I know this is crazy, not that they had a heart attack, but we couldn't do it there. So we had to put them in the helicopter. So we had 20 minutes to get them in the helicopter. So that was pretty exciting, because we were trying to get everybody. It took a group effort, but we usually would get them in the helicopter in 20 minutes, and then they would have their heart attack taken care of in under 90 minutes. So things like that was really fun stuff. And I met a lot of my still long-term friends there, because you grow close to the people that you work with every day. That was the hardest part about leaving the ED, with my people. So there's that. So next, we're going to do a typical day in IT. This is totally different. As you can tell, I'm working from home right now. We do have the opportunity in IT to work from home as needed. We're on call a lot, but there's 11 on my team, so I'm on call every 11th week. So it's not that bad. And especially if I'm out somewhere, I can pull up my phone or go hit some Wi-Fi, and I can help somebody. But again, I'm not education. Now, education would be a little bit different. I'm if something breaks in the system. And this Epic system is like $150 million. So it shouldn't break. But right now, during the whole COVID, I've been home for 2 months. I'm ready to see people again at work, but I don't think they're ready for us to go back quite yet. But actually today, we went live with 200 ambulatory clinics. So all the doctor's offices in Ballard went live with the EMR system, and we're doing it virtually. So hopefully today's going well. I'm on the acute side, which is the hospital side, so we're just going to help out with their help desk at the call center. So we have people doing different shifts with that. So a typical work day with IT, a lot more head knowledge than I used as a nurse, which is crazy. The nurse, when I was in the ED, I sort of, I gave medications, I started IVs. You would have to use critical thinking when it came to if you had a bad patient or whether or not to help them breathe or not, that type thing. But a lot of it was really skill driven, and you learn all of that in college. In nursing, we had labs, I know up at ETSU, and I'm sure they have it there at Tusculum. They have different labs that you can go in and try to start IVs on dummies and different things like that. And then you have clinicals. So you learn how to do the skills. But once you get out, you learn so much more, especially how to deal with people and in situations. But so in IT, we do a lot of things. We have projects that are due, and it might be a project that's a year out. So you have to prioritize what you're doing. We have so many people on our team, like I said, have different strengths. So I've got clinical people on my team like me, and then I have people that have, IT degrees that are really good with the stuff that looks like mumbo jumbo to me. So you have to work together on that. So we have different projects. We have to give presentations. Because I'm over nursing in IT, I have to give presentations to CNOs, that's your chief nursing officers. So you have to be able to present and speak and answer questions, even if you don't know the answer, make it sound pretty good and say, we'll get that answer back to you. You have to go into meetings with physicians. And again, like I said, sometimes they're hard to talk to, but sometimes you have a great one that'll back you up on that as well. We also have, when I worked at Laughlin, we did reboots where we would take the whole computer system down and back up. And that was exciting the first time I was able to do that. It was terrifying, but exciting once I could do it. It was just crazy how I took this nursing clinical job and went into IT and I learned it. So if you, always have your background, because that's a lot of it, they call it experience. So if you got experience in whatever it is, it's going to help you in your future, steps as you go on. I do miss patient care every now and then. But then when I think back at what we've accomplished, because I'm not really touching the patient anymore, but I'm allowing them to document as efficient as they can. And with the government and everything that they're wanting us to do, I know if you've been to the hospital lately, the nurse or the doctor's on the computer more than they talk. That's not their fault. It's not our fault. It's just the government makes us, we have to put all these initiatives in and pop-ups. So if the doctor puts in a medication and you're allergic to it, we gotta have a pop-up to say, hey doc, they're allergic to this, don't give it to them. So just different things like that, especially when it comes to medications. When they scan your armband and then they scan the medication, we wanna make sure you're not allergic to it, you're the right patient. So a lot of safety measures really help patient care. And so it took me a couple of years to really sink in that I'm actually really helping the patient. I'm just not touching them. But again, I'm thankful for where I'm at today. Again, especially with this COVID, that I have the ability to work from home. If not, I would have been frontline in the ED and hopefully not bringing it home to my family. So there's just a lot of opportunities. And nursing informatics, I'm probably going to be looking at getting my master's in that, just for fun. I don't have to have it for my job. Now, I will have to say a lot of different jobs, you need to have a bachelor's degree to do any type of management. So, and now they're looking at masters for management too. But if you ever want to get into management or lead people, they do look at your degree a little bit more. I'm trying to think of something else here. Let me look at my list. What type of skills do you need to be successful in your position? Like I said, Really just organization. You have to be able to prioritize. You have to be able to talk to people and present. And that comes, I've been doing this now for 12 years, so it gets easier as you go, and it gets easier once you know what you're talking about. So once I've been on Epic for 2 years now, so I'm a little bit better familiar with it, so I can really speak to it and be confident. What are some related jobs to your profession? Now, as a nurse, you can go into IT, you can go into, you can do home health, you can work at a hospital, you can work in a doctor's office, you can work as a school nurse. There's just so many opportunities you can as a nurse. You're not stuck in a hospital, or you're not stuck in a clinic or whatever. So there's endless possibilities. Same thing if you were an RT or a pharmacy tech. There's just all kinds of different avenues that you could take. What would I do different if I started out today? I'm not sure I would do anything different. I'm really glad that I didn't take my IT job when I was just in 2 years, because I think that it took me 5 years to really grasp the whole just nursing in general, because you learn so much with the different things that you go through. What was my greatest barrier? My greatest barrier at the beginning was talking to people and being able to present. So again, if you can just learn to do PowerPoint and present. Now, everything I've been presenting, and in IT, a lot of it's virtual or just like this. So I have probably, if I looked at my calendar today, I probably have at least 4 or 5, we call them WebEx meetings. Sometimes we do Zoom and we show our face, which is mostly when we're talking to executives. But we do this, this is a day in the life, is on the phone, and that's why I can, I guess, do it from home. But I actually put makeup on today, which I normally don't when I work from home. But I guess that's it, guys. Anybody have any questions? I see there's some in the chat saying, let me look at it here. I'm wanting to get swap. Heather, are you on there? I think everybody's on mute. I didn't know if anybody had any questions.
I am. I'm like trying to find out some questions here in the chat. They're just now popping up on mine for some reason. All right.
Okay.
Abigail Gibson, go ahead and unmute yourself and I'll let you ask your question.
I was wondering if you had a hard time switching over to Ballad Health.
Yes, it was more of a culture type thing, because at Laughlin we knew everybody, and it was a private hospital, and to go corporate, and then we all had to, like, I had to go to corporate. So us leaving that location and a lot of us having to commute, and they really, spread us, I don't know if that's the right word, they put us everywhere. That was hard to deal with, and especially the uncertainty of if we had a job, a lot of people's jobs changed, mine changed. So it was just all about embracing change and being thankful I still had a job. But right now, I feel like we're in a good place and we're going to be getting better. I know a lot of people look at Ballad as a bad thing, but my opinion of that is it's our hospital system in our community, and I think we need to back it. It's going to get better, because if we don't, there's corporate hospital chains that can just come in and just gobble us up, and then we'd just be, they wouldn't even know us, know our communities. So I think it's just, it's getting there, and it's taken a lot of time for all of us and our communities to embrace it, but I think it's getting better. Thank you.
That's a good question. All right, how about Lily? You can unmute yourself and ask your question.
Okay, so what's one of the worst things you've experienced on the job?
As an emergency room nurse, it was kids. So when kids came in, either we had an abuse situation. Those were hard to swallow. We've had, anytime that a kid was in distress and we didn't know what to do, anytime there's a kid, it was really, really hard. Now, again, we didn't keep them, so we would try to stabilize them and fly them out. But just that, and then the parent, and when you are a parent, it's worse. You're over here crying with the mom, but it's okay. So that was my worst experience on the job as an ER nurse. I really haven't had any bad experiences on the IT side. Again, it's not as life and death as the ED is, but yeah, that's what I would say. And death. Death in the ED when someone would die, especially when you work at a community hospital and you know everybody. So when you'd have a friend's dad that had a heart attack that would come in and pass away, it was really hard. So, yeah. Good question.
All right, Rachel, you can unmute yourself and ask your question.
Howdy. Do you have any advice for someone who wants to go into the medical field in general? Like what kind of classes to focus on, what to get ready for, etc.?
Hi, Rachel. I haven't seen you in a while.
Right.
Yes. Okay, so anatomy. So when you get into college, you have to take, so if you're going to be going into nursing or pre-med or any of those classes, you're going to be taking anatomy and physiology. And if you've never taken that before, it was one of my hardest classes because it was a lot to remember. And then they have a lab with it, and you have to remember all the bones, the muscles, and all that stuff. So if you could get anything on anatomy and start learning anatomy, that would help you your freshman year. Once you get into it, into your degree, like once I got into nursing school, I wanted to be there and it was super exciting. So you just got to get over that. And pharmacology. Pharmacology is a lot of memorization with drugs and medications. But if you could just get a head start on that, you'll be good. Thanks, Rachel.
Okay, does anyone else have any questions? She may not know the answer. Okay, perfect. Here we go.
Hello, Miss Heather.
Hello.
This is really going to be hard for me to say, but like, I just went through a lot of stuff last week. I missed last week's classes and everything just because I had an allergic reaction to Tylenol and then peanuts on top of each other. And like, I had wisdom teeth surgery. That's why I was allergic to the Tylenol. And like, my dream is always to be a flight nurse. That's something I've always wanted. I've always fought for it. But with all this going on, where I'm so sick, it's been very challenging. And I've just wanted to cry and give up. And I can't sleep in my own bed. I can't sleep in the recliner. I laid in the floor for nights just crying because I'm in so much pain. Is there opportunities, like, even though like I'm still sick and I have like I go to the doctor Wednesday and I'm diabetic pretty much because my sugar went to 32. My blood pressure got 300 over 200. And they're like, how are you still alive? I was like, I don't know. I guess I'm praying. I don't know. But like, I'm needing some advice. Is there still a chance where I can be a nurse and work at home? Or, because I don't know what the next step is going to be. Because it's very hard. Like, there's some days I can't walk. There's some days I can't eat. Just different situations. Like, I walked in the store the other day and my mom's like, Lori, you need to sit down. You need to do something because, like, you're about to pass out. Because I was, like, shopping and, like, I didn't have any energy at all.
Well, first thing, get you a good doctor, and hopefully they can get you all figured out. But again, when it comes to that, you can still be a nurse. Now, I know in nursing school you have to take a physical and you have to take immunizations and you have to take your flu shot. Regardless, a lot of people don't. You have to take it unless medically you can't. But in order to be a flight nurse, really all that is, you do have to have a little bit more physical there is different things, I guess, when it comes to being able to be in a helicopter and all that, but really you'll need, I think, 5 years of critical care experience before you can sit for your exam to be a flight nurse. So as long as you either work in the ED or the ICU for 5 years, and then you sit for a certification as a flight nurse. So that's it for that. So yeah, keep dreaming, girl. You can do it.
Thanks. I'm actually, we're trying to see if I can get some kind of like disability or something, just because it is so hard and I can't really, walk as good as I used to. And I'm not like physically in my shape, but I'm a first responder. I volunteer at Newport Rescue Squad. So when I'm fighting to get back in that turnout gear, I'm fighting, and like we're trying to get me into a horse therapy group where I can like run and jump on the horse and just build my strength back up and stuff. And I'll be a CNA in December when I go back to
awesome.
school. I'm going to start my clinicals. And actually, I have my stethoscope with me. I'm so excited about this because it's the Littman Cardiology 5.
Awesome.
I mean, $250 that I've worked very hard for is in my hands, and it makes me very excited. And I'm wearing my new scrubs because, I'm sitting at home and I ain't got nothing else to do.
Going and taking CNA classes and being a CNA, I think that is a good thing because you will appreciate that, because a lot of people that's not done that type of work and went on to be a nurse or nurse practitioner, all that, and they don't understand what a CNA does, those will help those CNAs out. So I think that is a good thing. You can get in there, you can meet people. That helps with trying to get a job when you get out. So all those relationships really pay off. And then they can already know that you're hard work and all that. So taking those steps to do CNA first is a really good choice. Good luck.
Thank you.
All right. How about anyone else? Any other questions? All right. Abby Grace, you're up.
Hey, it's me again.
Hey.
There's a lot, going on in the world right now. So I was just wondering, like, if you had a funny story, like your funniest story from the ER.
Oh, geez. Oh, I do have a funny story. Okay. I was trying to think because it's been a while. But so when you first come into the ER, they do what's called triage. So, your stint for that shift, you may be the triage nurse, which means you're the first person that the patient sees. So you have to get why they're there, their blood pressure, all that. Then you got to figure out based on their acuity where you should put them and all that. Well, we had a probably a 6-month-old in there with a family member, and we were talking, and she said that she was sick and all that. Well, then she vomited, and it was pink, and we were all thinking, oh my gosh, what's going on with this little kid? Is it blood? What is it? And finally we figured it out. They gave the baby strawberry milk as we were all freaking out, and it was strawberry milk because we're like, what's that smell? That smells like strawberry. What is that? And you're like, oh my gosh, it was strawberry milk, and it was everywhere. And we were thinking, as a nurse, you think of the worst, like, what is it? Blood? Is it, what's wrong with this kid? What's their vital signs? Their vital signs are perfect. And it turned out to be strawberry milk. So I've got more, but that was just the one that popped in my head. So, but there is a lot of laughing times in the ER, as well as sad ones. But, and then there's the good ones where that patient comes in and they're dying, and you get them back and then put them on the helicopter. But I always call up there to say how the patient was and to get that response of they're doing great, they're in recovery. Those are the times that you really love your job and be like, I made a difference today. So yeah, great question.
Okay, I have a question for you this time.
Okay.
My question is, as high schoolers, are there any positions available for our students to apply for and work just to get their feet in the door, kind of, I guess? I don't know how else to ask that.
Well, I do know CNA is good, but there's also, right now during COVID, I'm not sure about this, but high schoolers can be volunteers. So there's a volunteer program there at Laughlin. I'm pretty sure they still have it. And you can get your volunteer hours. That looks really good for those scholarships. And you can actually, you can, transport patients. You can gain those relationships. You can, help out in the ED. You can help out in a lot of different places. But you definitely can volunteer there, but you don't get paid for it. But like I said, you get good experience, and you can put it on your scholarship resumes. So.
Perfect. Thank you. Right.
And also there's a lot of different schools. So you can get your associate's degree, and then either at Walter State or any of these other 2-year schools, and then they have bridge programs for the bachelor's program if money's an issue. But nursing schools, they've got Tusculum, they've got ETSU, they've got King, there's so many opportunities everywhere, and probably a lot of financial assistance with that, because we're still at a nursing shortage. So yeah.
It's good to know. I mean, it's kind of a bad thing, but it's good to know that.
Yeah.
All right. Any other questions? I think that might be it. They're very quiet today.
Well, I normally always get the ED questions because IT is a little boring. It's okay.
Have you had any funny or odd experiences with doctors and trying to do IT stuff?
Yes. So on the cool new badges, like if you get a new badge, we have this cool technology made by IT where you can tap in and it automatically logs you in. You can do a lot of stuff by just tapping your badge. Well, when I was at Laughlin, I was over like the education part too. So I went to go meet a doctor, and all I asked him was, hey, do you have your badge today? And we had signs everywhere that this was coming, blah, blah. Well, before I could get out, it's okay if you don't have the badge. He threw an absolute fit. He threw papers across, and I was like, what just happened? He's like, I don't have my badge today. I can't do this. I was like, yes, you can. Just calm down. So, and he's not the only one. They throw little fits. And I was like, if you would just calm down, we can still do this without your badge. So they get a little uptight if they don't know what's going on, or they forget and it sort of creeps up on them. But you just have to learn to not throw it back at them, because you just have to show patience.
They're good in stressful situations, just maybe not tiny.
Yes.
Situations.
Yeah, tiny. Calm down.
All right, we have one more question. McKenna, go ahead.
How did being a nurse affect like your lifestyle and your health?
Oh, that's a good question. Good question. So depends on what type of a nurse you are. There's more high impact. Like I said, when you work in the ED or the ICU, you deal with death, you deal with situations, you deal with some situations you can't talk about. So you really have to, it can affect you because sometimes you have to keep it in, you have to bottle it in. I will have to say too, it did affect me in the ED negatively sometimes. Like you'd have a bad day, or you'd have people that didn't appreciate what you did, or they don't understand what you do. So as a new nurse or as a new healthcare professional, that's hard to take, but your skin gets hard after that. So it takes a while to get there. So it is a struggle because, again, a lot of people in the public don't know what you go through. So if you're in the medical field, you have to stay with your mind being healthy. Physically, it is, if you work in high-paced areas like the ED or short stay or something like that, you're going to be working, walking a lot more. That was good for me because when you went to an IT job and you sit all day, you gain weight. But as far as your mind is what gets you in. You have to keep it together because you have to go through so many things. So good question. And you don't want to take it home and on your family. So you might clock in and clock out as a nurse, but sometimes it's even when you clock out, you take it home with you, even though you shouldn't take it home with you. So good question.
Okay. Anyone else?
My question is, if you do have a bad day or, maybe a rough situation with a parent or DCS or whatever the situation may be, is there like people there you work with that you are allowed to mention to, like say a chaplain or a fellow nurse, somebody that you can just kind of say, hey, I'm having a bad day, give me some encouragement or something, without invading privacy rights and all that?
Mm-hmm. Well, we always had a great nurse manager in the ED, and you could go to her office, shut the door, and cry on her if you needed to, or just pour it out on her. We also had nursing supervisors, and you could do the same thing. They're there, and you can talk about patients to them, or a patient situation. I would be really safe talking to them more than anybody, actually. So I know I had great experiences with them, and that's, again, building that relationship. So if you build that relationship with them, you'll feel free to talk to them. So that's what I did. I had a great nurse manager, and she would talk to us, encourage us. She's the one that encouraged me to, take a different route and go into IT. So when you have those good managers, always praise them a little bit and be thankful for them, because I've had some bad ones in the past too. But yeah.
Because I know in past situations, being a first responder, I've had patients, deceased and everything, and that was very hard and emotional for me at first, because I went home and I just laid in bed. I wondered, could I have done something different? And then at the end of the day, I realized, hey, you couldn't have done it. You've done your best. You tried. And then I talked to the chaplain within my department and everything, and that kind of really just helped. Which, struggling from anxiety, depression, and PTSD was always hard for me. And I'm actually seeing a therapist for that. But she's like trying to praise me or something, just because I've done so much and I've learned so much from that. And I've had past experiences with DCS myself. So I know that that's kind of really stressful, but I've worked through it.
It's always good to get it out, to talk about it. Yeah, that's good.
All right. Any other questions? Okay. All right. Well, Haley, thank you so much for your time and your insight. I feel like I managed to get an RN, IT all together in one. This is like a win-win for some people.
Mm-hmm.
So remember, if you all are interested in becoming an RN or even going into IT, hospitals have positions. So,
let me tell you that. Guess how many positions we have in IT and Ballad Health? Almost 800.
Wow.
That's how many IT people it takes to run this system. And like I said, it's the top big system. So IT is needed. And you can work from home a lot.
That is very impressive. I didn't realize it's so many.
Yeah.
Wow. Okay, well, that's good to know. I feel like that is the fun fact for the day.
Yeah.
All right. Well, thank you so much for stopping in and chatting with us. And I'll be in touch with you through email, because I know we have a couple of things to kind of clear up and make sure we get taken care of. But thank you so much for your time, and I'll see you soon.
Thank you. Thank you all. Good luck.
Thank you.
Bye.
Bye. For everyone else, you are going to complete your career speaker journal.